I always like to start out with the national numbers so that you can see. Here is our, I hope, can you see when I point to it? Okay.
Yes.
So this is where we are now. Our cases have continued to go straight up. This is where we were in July. The peak occurred July 17th, and then we went down, and everything was going down. And then when we opened up and got ready for school, it started slowly going up in October, November, and then we had the holidays. We had our peak. Vaccinations came here in December, and we started going down very nicely. We said, wow, this is over. And then we went hiccup, hiccup, and then we went down again. This is where we were towards the end of June. Then at the end of June, we kept saying we had to wait for Memorial Day and the 4th of July. And sure enough, almost at the timing exactly, we saw the super spreaders that those two holidays occurred, and so we started going up. The problem is here that at the end of July 17th, this curve started going back down. Here, July 17th, it continued to go up. So what we're hoping for the best case scenario would be that we can start having a little bit of a decrease. I'm going to show you some numbers that look hopeful. And that then we would go down a little bit, just enough to get us back up again then when the holidays come, and then because of vaccinations that would be able to go back down again. But that is just forecasting, and it's hard to tell what this thing is going to do, especially I'm going to show you some of the numbers of the Delta and see how that influences all this. So this is what the country looks like right now. This is all from the CDC website. You all can go on this. If you just Google CDC data tracker or COVID data tracker, you can get right on and you can see all these pictures that I'm showing you. I have all the websites here cited. So the only one that looks like it's in moderate instead of, or I should say substantial, is Vermont here right now, but the entire country. Now, this does two things. This has caused a lot of problems for staffing, for the hospitals, to be able to get people across from different industries, such as healthcare, to help one another, because the entire country is in the same shape that we are here in Florida. So this is different. These are the four numbers that I think you can utilize to guide you in terms of how much community spread, and then base your actions based on that community spread. So this, we're in high now, and that's as long as it's above 10. Substantial goes between 10 and then 5. Moderate once you hit 5, and then at the end of June we were down to 2%. At 1% you are at low. So that is the aim, is to be at low when you start feeling comfortable that things might have an end. So we're a long way from that. We basically are starting all over again in this high that we are at now. So this is what I think even more important is how many cases we were getting per week. So with our first hike in July, we were about 5,000 cases per week. So we were under 1,000 per day. At the height of January 16th, we were at 6,000 cases per week. Now we are at 9,000 cases per week. Now we've gone down a little bit in the last week or so, and we're keeping our fingers crossed that it's not just a little dip, but that it will actually come down a bit. So we're very high, the community spread is very high, and that's why we have to keep an eye on it. Now why? It's basically because of this problem right here, the Delta. The Delta now nationally is at 99.1. That includes its two children that it's had, AY2 and AY1. There's also an AY3. But the AY2 makes up 0.2%, and the other one 0.1%. So it's at 99.1% of all the variants. Everything else has disappeared. Now you will continue to hear in the news about new variants here and there. Those are constantly coming up. So don't get crazy about all these new variants that they're talking about. That is normal. Viruses have variants. That's how they continue to work. That's how they continue to circulate globally for the rest of their existence. We still have H1. That's what's in the flu vaccine. So this variant is causing a lot of the trouble because not only is it more contagious, it's more easily spread from person to person, but it's also causing some of those breakthroughs where you hear people that have been vaccinated. The vaccine is doing its job. Why? Because the vaccine's job is to keep you out of the hospital and not dying. So I don't want people saying the vaccine's not working. The vaccine is working exactly the way it's supposed to work. And so far, Alonso said so far, it's working against all of the variants. Now, it will get to the point, if we don't vaccinate enough people or enough people don't become immune to it, that it could then create a problem where you have a variant that's not responsive to the vaccine, and then you have to develop a new vaccine. I'm sure they're already working on a new vaccine. Okay, so our numbers here, you can compare Florida, the daily positivity down to 14. Ours now is down at 13.3. And what we have had is the count, we're down to 712. We are thrilled right now to have only 712 as opposed to the close to 2,000 that we were having. So we're seeing a little dip. What we have to see, is this just a dip that's going to go back up, or have we actually made a difference between the 11% increase in vaccination that we have had? Now, who are the people that are getting vaccinated? The group that has had the largest increase is this group down here on the bottom, that these are the 12 to 19-year-olds, okay? They have had the highest peak, and I thank the healthcare district for the great job they did over the summer in getting all those kids vaccinated, and especially the parents for bringing them in and getting them vaccinated. So this group is about 50%. The age right above them, the 20 to 29, is also doing pretty good, but they're just below 50%. So when you see, and they tell you the total vaccinated, that means the people that have gotten only one dose, those had completed the series, you add that up, you get total vaccinated. The number that we need to look at is the fully vaccinated, right? The ones who have completed their series. That's the number that really matters. So be careful when people use different numbers, because that throws some people off. They said, oh, the other day you said 60, now it's 70, what's the deal? These are the different terminologies that are being used. So you can see that this number, whether you use the 71% or you use the complete vaccination, is hyperinflated, because these people, this is the 70 to 79-year-old, and the 60 to 69 are above 90%. So when you take the average of all these people, plus these that are only at 50, you come up with these numbers. So we have a long way to go for this group. The ones who are flat is the 80 and over. These folks, a lot of them are in nursing homes or at homebound, and they have sort of leveled off. They're getting a little bit more vaccinated now, but not a whole lot. And the group from 50 all the way down to this 30, so that group has been pretty parallel, increasing, but not as much as the 12 to 19-year-olds. So I'm very happy for that, because that means these kids are the ones you've got in school, and that's good that we're getting there. Okay, so what are the cases in children? I've been asked that a lot. I try to create this graph to show you how these numbers are actually increasing. This is where we were back in May, June, and then in July these numbers started going up. So what you see right now is that the 13 to 18-year-old make about 39%, but the biggest chunk is in the 5 to 12-year-olds. That right now 49% of our cases. And then the under 4 is only 12% of our cases. But these numbers have dramatically gone up. And that is why it makes sense, right, that you're having the problem you're having at school, because you've got a lot of these kids that are actual cases. And of course, the under 12 can't be vaccinated, so obviously that's causing the parents. The parents are constantly asking me, when is the vaccine coming out? When is it coming out? I want to get my kids vaccinated. It's still slated. Pfizer will be the one that will have it out at the beginning, and we believe the age is going to be 5 to 11. They hope to have it by late fall, early winter. They switched from actual months to just giving us that break. So part of what happened is that because the number of cases went down, they had to wait a little longer than expected to get all the numbers that they needed in the study. And that's what, that's one advantage of having a lot of cases, is that you get, the studies get done quicker because you have more people to put into your cases. So that's just to give you a little picture of where we are and what the percentages are. The thing that we have now that is very useful, this is another thing that I'm being asked, is the number of new hospitalizations. pbcgov.org is the Palm Beach County site. They now have on the top of their COVID banner, they have hospital dashboard. This is available every day. There's 14 hospitals that are reporting every day, and they're telling them, they're saying the COVID admissions that they have as of last time, they had 90 admissions coming in. They had 72 going out. So that's something that you look for in a hospital, right? You want to try to either have an even number, but you always try to have more people leaving than they're coming in. Right now, we're having more people coming in than out. That clogs up your hospital, obviously. The people dying, I want to make sure that no one says that I'm saying that the kids are dying. I'm saying we're having more cases, okay? We're not having little children dying. We're not having young people dying. Most of the people who are dying are the elderly. They continue to be the elderly, a lot from nursing homes, okay? And a lot of these people have other conditions. However, there are deaths that are occurring, and we have to keep that in mind, okay? And we're also having the younger children having the multi-system inflammatory syndrome. That's very concerning. And we have a lot of folks, especially athletes, who are young, healthy men and women who are now on multiple inhalers and multiple heart conditions and multiple other things that they will have for the rest of their lives. The younger you are, the more chances you have of having long-term consequences, including mental health issues, as a result of COVID. So COVID, we all know now, is not just a cold. It's a serious condition, and it will have even more long-term consequences. So the other thing that we can gather from this is to see how much of the COVID admissions are children versus adults. 98%, this one shows it here, or 861 cases right here were admissions with COVID as adults, and only 16 children, or 2%. That is good. That has gone down. We also can see how many are in the ICU, adults versus children. 97% are adults, 6 or 3% are children. In terms of all admissions of vaccinated and unvaccinated, that number has gone down drastically. Just a few weeks ago, early August, they were up to 98% of people were unvaccinated. Now it's 81% of the people are unvaccinated, and 19% are vaccinated. Some of those are elderly, coming from the nursing homes and having problems. So that's just a few of the things that you can gather from this. I think it's a good, we're very happy to be able to have this now. This is a lot of work for the hospitals to have to do this, as busy as they are, but we're finding it that's very important, and that way everybody can keep track and look at this and know how we're doing in the hospitals. So please, next time you talk to a nurse or a doctor, please thank them. They're doing a phenomenal job. They're very stressed. They're working very long hours. There's not enough people to take care of COVID patients. Not only are they more difficult to take care of, but they're more demanding, and the stress of doing this now for over a year and a half has taken a toll on all the medical professionals. So please thank them, as well as I thank all of you for the job you're doing here at the school board. So we need to thank these folks. In summary, this continues to be a pandemic of unvaccinated people. The Delta virus is definitely playing a role in this. It continues to spread. And now right here in Palm Beach County, it makes up 100% of the variants. It's 60% more contagious. It causes breakthrough cases. Hospitalizations are at a critical mass. You don't have to be one of those people in the hospital. Please get vaccinated for you, for your family, and for the rest of your community, that we deserve to take care of one another. So thank you for your attention. If there's anything that you want, or you want to finish the presentation and then ask us questions? Or?
Dr. Alonso, if you don't mind, I'd like, some of the board members would like to ask you some questions before
Sure.
we move on. Vice Chairwoman Brill, then Mrs. Whitfield.
So first, I just want to say thank you so much for making time out of your day, Dr. Alonso, for all of you, to update us. It's terrific information. I do have 2 questions, so I'm going to go with the first one, and then after you answer, if I may, I'll ask the second one. My first question has to do with the flu vaccine. Last year, I know that it was recommended that everybody get a flu vaccine because of it would minimize the effects, and I won't go into the reasons, but what is your recommendation regarding flu vaccines this year?
Absolutely. The flu vaccine is very important. If you get the flu vaccine and you don't get the flu, that's one less thing that you have to worry about. Right now, the recommendation is any symptoms that you have, do not go to work. And so if you get your flu vaccine, that's one less thing you have to worry about. Last year, we had the lowest flu conditions ever. Many of the asthmatics did not have to go on antibiotics. I mean, I think many people who have respiratory illnesses are actually going to be, especially asthmatics, they've told me, I'm wearing my mask this year for the flu season because it stopped me from getting the flu. It was the first time ever that I didn't have to go to the doctor's office and so forth. So, you know, that is one issue that is very important. Thank you for mentioning it. It's already available at the pharmacy, so go ahead and roll your arm up and get the flu vaccine.
Thank you. And if I may ask my second question.
Ladies,
Go ahead.
My second question is whether, just out of curiosity, are they using the monoclonal antibody treatment on children as well as adults now? Do you
No.
know?
We have the monoclonal available here at West Park, Westgate. I always want to change everybody's name, including my own, over at Westgate, and you go through. You have to, in order to get the monoclonal therapy, you have to have a positive test, and then you should be at risk if you're at high risk for other illnesses like diabetes, HIV, any of those things, and that will help you because they're actually going to give you antibodies, so that will help you not further the disease. So it's very useful. It is available to us. If you don't have a physician, you can get it. The Surgeon General has a standing order. This is something the governor put together to help us have that treatment available. And he's spreading it throughout the state, so it's another option for treatment for COVID.
Thank you.
who's saying that? Stop with the comments over there, or you're going to leave the room.
I'll go ahead and take another question.
Thank
Yeah,
you.
Mrs. Whitfield.
Thank you.
Officer,
First of all,
Officer, who's doing that over there? Ask her to stop or she leaves. Go ahead, Mrs. Whitfield, ask your question.
thank you so much. I just want to say a huge thank you for you guys coming today. This is something that I really appreciate, all the work that you've been doing. I do have two questions. The first one is about the pediatric ICU beds versus the adults. When they run out of space for adults, do they ever put them into the pediatric, or is that reserved spaces just for children?
They try to keep it reserved. If you've ever gone into a pediatric unit, the beds are smaller. They're actually made for pediatric patients. However, if you notice on this side, that tells you the total capacity. They are over in beds in the general and in the ICU. This minus number means that they have capacity for 341 beds, but they actually are using 356. So they're in the minus. So they're using more beds than what they have. What they've done in many of the hospitals is created extra areas where they can move beds to. And the pediatrics does have a capacity. They're at 24%, so they have 11 beds available in general. This is all the hospitals put together. You want to keep these numbers. You don't want to ever be more than 75% occupied, so that you have 25% overflow in the beds. What this creates is that then when somebody wants to get into the hospital, they're having to keep them in the ER. And there's a section here somewhere where it shows you how many people are being kept in the ER. It's on here somewhere. It's too little. I can't read it. But so take a look at that, and that's what this is useful for. So that kind of gives you the fact that we're really, the hospitals are definitely overwhelmed. They're doing a heroic job in moving things around, creating extra space, and moving those beds around.
Thank you so much.
Oh,
I
and
feel
and the
like this is-
ventilators are great. They have enough ventilators. These are the COVID ventilators and the regular, other than COVID, but they have enough capacity for the ventilator. So we're good in that here in Palm Beach County.
Thank you. These are very impactful numbers, and I'm so glad you're sharing them with us. Can I ask you a little bit about contact tracing? One of the difficulties I know is that we've put such a burden on the health department by the school district, relying on you and the work that you're doing. So, can you explain a little bit about how you guys are handling that extra burden and if you're adding staff or if you are kind of at the end of your limits, whatever it is? I would just love to hear
Sure.
more about that work.
It's not a burden at all. It's what we do. That's one of our primary jobs. Epidemiology is really the building block of public health, and we do that all the time. By the way, we do contact tracing for other things besides COVID, so not only do we do this, but we still have hepatitis, TB, and all those other things that we also have to take care of. So what we did, yes, and we've added staff. We had staff when we were at those high peaks. We shifted some of that staff to do other functions, like immunizations and other things like that. So we've been doing community outreach with our vans, and we've been testing as well as vaccinating. The vaccinating has gone down, the testing has gone way up. And so we've been utilizing that staff. And when we saw this coming up, we were ready in July. I asked before we had the numbers going up, I told the state I'm going to need about 60 more people in the coming month if we go up. So we were first in line to get that staff, and indeed, when we started going up, we started asking for them, and we have gotten all the staff that we have requested. The problem is not getting the state to give us a staff or the positions, it's recruiting people. And because so many people are out of work, so many people are sick, you have to have extra staff. And one of the big concerns that we have is making sure we keep our staff healthy and continue to work, just like you're trying to keep your teachers healthy and continuing to work. This is happening everywhere. This is affecting restaurants, it's affecting the hospitals, it's affecting all our businesses. So we have to make sure that people don't go to work sick so that they can need to quarantine or isolate as needed, and that way they don't spread it to the other employees. So it's very important that they don't come to work sick.
Mrs. Andrews?
And thank you, Dr. Alonso and team. As I look at the graphs today and we listen, you've been with us from the beginning. This team has been with us. And when we see ourselves at one point, this is so fluid, we don't know where we'll be within the next 5 or 6 weeks from now. And we could see it from all of the months that we've been going through this. And I want to thank you all for continually informing us so that we can make the decisions based on the data, the health information, and how we're doing. Right now, we thought we would be able to open the schools with masks optional, but this Delta variant came right in here and says, no, it's not going to happen. And we could see it from your graphs, but we were making some progress. And we had all of the children home. We know the best place for our children is in front of a teacher within a school. And right now we're in the situation where we're doing our best. We can't do 6 feet apart. I mean, that's why the masks are so important. Every mitigation process that we do right now is critical. With almost 5,000 students out on quarantine, I worry. I'm so thankful to have a nurse in almost every school in Palm Beach County who can get started with the contract tracing, and all of our staff, everybody working together to take care of the children. So I just know that we're going to need you to come back, and I know that, we need you. As I talked to Mr. Burke, we're talking about making sure that we have some testing sites and some vaccine sites for the children, because we know that the little ones just don't have that protection right now because they don't have a vaccine. And I worry a lot because the one question I want to ask you, I worry about the Glades region. It's a region where I know the hospital truly has been full and they've had to maybe send people elsewhere. Can you tell me about Palm Beach County as we look at this? It doesn't say particularly where the most everything serious, but I do believe we have some areas of Palm Beach County that are much worse than others. So can you help me with that a little bit?
Yes, absolutely. As a matter of fact, I was on their health advisory committee that met this morning, and they had a wonderful presentation on how the hospital is doing much better. The healthcare district has again done a yeoman job of being there. Your lines weren't too bad this morning. Your van was there. They were vaccinating. But unfortunately, they're testing more than they're vaccinating, so that's not good. There's still a lot of hesitancy. So for an area that we knew was going to have difficulties, we specifically went out there. We worked with all the churches. We worked with all the community leaders. But the hesitancy continues to be there, and a lot of it is misinformed information that they have. Once they talk to you and they get the information, they say, oh, I didn't know that. So we're working really hard to try to get as much information to the folks that want the information. If you've already made up your mind, you've made up your mind. But if there's still questions to be asked, if there's still information they need, we're there. We're doing all kinds of community outreaches. The hospital has been doing a really good job. They've been able to hook up with the VA hospital thanks to FEMA and to the federal aid that came to make the rural hospitals associate with the VAs. They were able to take some of those patients, and they have agreements now that the hospitals have have a little bit of relaxation in order to send patients to other hospitals if they need the specialty care that they need at some of like the pediatric units that St. Mary's has and so forth. So that's some of the work that's being done out there. And all the faith-based churches are trying really hard to, give it one more shot. Also, the county has been doing a big media blitz in terms of encouraging folks to get vaccinated and get rid of the myths that are out there. So they're trying to do that to all those who want to listen.